The sign for the now defunct emergency room still hangs outside the Dr. William H. Newhook Health Centre. That's even though the ER here in Whitbourne has been closed for more than a year due to a shortage of doctors. In mid-March, an urgent care clinic reopened in the ER's place, aiming to operate 8 to 4, 3 days a week, Monday, Tuesday, and Thursday. But the schedule hasn't been consistent. Some weeks it's open Tuesday, Wednesday, Thursday, or another combination of days. Whitbourne Mayor Hilda Whalen calls coverage uneven.
Well, a lot of people are concerned about the schedule and they don't know which days are going to be open. But I tell most people, just call the clinic as you would for a doctor's appointment. And what is happening is they are finding doctors, maybe locums, or if they can get a spare doctor that's not in a hospital somewhere, they're trying to fill in there. That's how desperate and how few doctors we have.
24/7!
Andrew Pretty, who's organized demonstrations to demand better health care in the area, agrees. He says people are frustrated.
The hours lately are so sporadic and ever-changing. It's impossible for people involved with the committee to keep up with it, let alone someone from the public trying to figure out if it's open or not.
Health officials promised this urgent care clinic would be open 3 days a week and would eventually expand to 7 days a week once they recruit more healthcare staff. But the same problem facing the ER is now facing urgent care. Too few doctors. And while both local leaders want to see a 24/7 ER restored, Whalen says there are bottlenecks preventing that from happening. They both would like to see Memorial University accept more internationally trained doctors to get licensed and trained to practice in Canada faster.
They're only taking, I believe, 7 practice-ready assessments positions this year. And once they're filled, there's no more going to be offered.
And I think the government themselves are finding that it's not so easy to recruit doctors as they thought. I know you heard me say, put the money on the table. Well, it's not all about money. They also need to be licensed.
And Pretty says the sporadic hours will skew stats officials use to measure how well urgent care is working. Heather Gillis, CBC News, Whitbourne.